This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by the one and only. There's a podcast I listen to where the host always introduces the co-host with some magnanimous title.
Yeah, I like that.
The magnanimous Jason Martin, MD. He's a board-certified plastic and reconstructive surgeon.
I'm very magnanimous.
Dr. Wright, how you doing?
Doing pretty good. How you doing?
I'm good. I'm not magnanimous, but I'm not that special.
But you're extremely intelligent. You're beautiful. You have an amazing radio voice.
Thank you. So welcome.
There's hope for you in your career.
So glad to have everybody listening today. We have a very, very exciting episode today.
Yeah.
Because for the last few months, if you've been listening to the podcast, you know that I have been...
She's been Carly Rae Jepsen.
Call me
maybe, please.
Call me maybe.
Every episode.
Please call.
Please call my voicemail. Mm-hmm. I mean, I'm sitting here by myself. I don't have a lot of friends. I just need to talk with you. And people actually call.
They did. Well, and I grew up in the 80s when I loved talking on the phone.
Sure.
So, you know, I like voicemails. And some of you have actually called in, and I'm very excited today to share your voicemails. We'll answer your questions. So this is not our typical questions from viewers, because this time we actually have voicemails to go along with
and
this
we have
question.
their voices. They're going to be famous. Very famous.
Very famous. So if you would like to watch this podcast, if you are listening on a podcast app and you'd like to watch us, you can find us on YouTube at at Jason Martin MD on YouTube. We're on Instagram at Beauty and the Surgeon Podcast. So not super interesting slides with this one, but you will get to hear some stuff. So
yeah. And thank you to everyone who called in. I mean, it's just awesome. Like the interaction that we've had. I mean, we get so many consults from people that love our podcast. And sometimes you wonder if they're just doing the consult to actually talk with us.
I don't think we're that good.
No, I know. But I mean, I love that too, to be honest with you. And just that support and just the overwhelming, like positive, input from people that listen has made us really excited and excited for the future. We're on 96. We're almost to 100. I think we're going to 1,000 episodes, Amy. I think that's what we're trying to do.
I think that's a good goal. So again, if you are watching, or if you would like to watch, you can find that on YouTube. If you're listening, prepare to be amazed and surprised by our fabulous voicemails. So should we get right into it?
Let's do it.
All right. So our first voicemail, I love. We will play the whole thing, but is from a patient who is part of a kind of a plastic surgery group. So if you are part of one of those groups, you want to share our podcast, we would love that. Talking about swell hell.
So where are these groups? Is it like a Facebook group or?
Facebook, probably Reddit. I don't know.
Okay. That's cool. Yeah.
Yeah. I'm not cool enough to be part of a group, so I don't know.
Yeah. Because we did have a patient inquire about something recently, and she was part of a tummy tuck Facebook group. And I thought that was really interesting.
Yeah.
So people interested in tummy tucks, people have done tummy tucks, and they're all together like trading stories and suggestions.
Yeah. And remember to keep all of those patient to patient, everybody's experience is different, as we've talked about on podcasts before. So, if you really genuinely have questions, we are happy to answer those as well.
Yeah.
Or you're providing physician.
Yeah, because is there plastic surgeons in those groups? No.
Even if there were, you really
You always wonder.
Yeah.
I don't think that's appropriate.
No, you really shouldn't be giving advice that way anyway. So, All right. So without further ado, we're going to listen to our first voicemail. Are you ready?
What's her name?
Her name is Michelle.
Okay.
Yes.
Hey there, Amy, Dr. Martin, and Mills. This is Michelle from California. And Amy, I heard your plea for voicemails, so here you go. Why do tummy tuck patients often experience swell hell 4, 5, or 6 months after surgery? I'm a member of 2 Facebook tummy tuck surgery groups, and after pooping issues, this is by far their biggest complaint. So obviously swelling is going to be part of the healing process, but some of their daily fluctuations are really dramatic. And they're chalking it up to what they're eating, or if they've stopped wearing binders and fajas, I think is how you say it, post-surgery. Some of these gals are still wearing the fajas like a year after surgery to prevent swelling. So can you break down swell hell for us? Thank you. Bye.
All right, so I love this question.
I mean, swell hell. It was,
the most I
never
heard
learned about swell hell in plastic surgery training.
No, that's actually.
By the way, she gave Nils a shout out,
Yes.
which was like so good.
That's actually a term I had never heard used, and there are a lot of these out there. Like people will use these terms, and I'll be like, "What?"
Yeah.
But I think what she described there is basically swelling that is persistent, is what I would call that. Persistent swelling postoperatively past like the 3-month mark.
Right. It's past where you would expect normal postoperative swelling.
Well, but see, to me, I would tell someone
normal postoperative swelling from the surgery itself. Chronic swelling after surgery is different. And it's definitely cyclical. Yeah, exactly what she was describing. And that's what you would expect, actually, in some cases.
Yeah. Well, let's do this.
Okay.
Let's both answer it because
Okay.
this is such a good one. So what would you say to her?
You go first. No, you go
Or
first.
me go first. Okay.
I just want to make sure my answer is better.
Oh,
You go
okay.
first.
Okay. So this is a really good one. And I would first tell this patient that experiencing swelling, especially intermittent or cyclical swelling 5-6 months after surgery is absolutely what I would still consider normal. So
Right.
to me, that is well within the range of normal, especially if you had a tummy tuck with a lot of liposuction. Swelling is going to be expected for the first 6 months. So at that point, I would say this is still very normal. I would highly encourage someone not to wear their surgical garments longer than their surgeon tells them to. We do not encourage patients to consider wearing a compression garment past really like 3 months.
Do you remember that patient that came in was wearing the surgical garment a year out?
But she was wearing it for recovery. So she was a triathlete.
Okay.
Totally fair.
But it was totally random. I was like, I think the period of the surgical garment is over after probably a couple months.
Yes. But she was a triathlete, was wearing it for workout swelling. And her garment was not one it was a stage 2 garment. So it was almost like a Spanx, not like a very intense like corset, like what she's describing some of these women wear, or like binders that are really tight. The issue that you're going to run into is if you continue to rely on your binder specifically, let's just say binder, not just compression, you're doing two things. You're basically forcing a lot of fluid out of that area throughout the entire time you're wearing this binder. And then when you take it off, that area is going to have a period of like balancing again. So there's going to be some osmosis happening where fluid needs to come back through there. You saw this with women, when in the days of wearing corsets for dress, that they would pass out. That's because blood flow is being restricted. If blood flow is restricted, lymphatic flow is restricted. So wearing a very tight compression binder for an extended period of time might actually be contributing to these periods of swelling and why you swell. So you got to wean yourself off of it, would be my advice to that person. You're going to swell initially when you stop wearing it. You're also going to swell initially when you start working out aggressively, if you are stressed. Water balance can play a role, absolutely.
Alcohol.
Diet can play a role as well. So drinking, and just in general, if you are eating an extremely SAD diet, standard American diet, you're going to have more issues with periodic swelling as you recover. So that's what I would say. And the pooping issue we can talk about too.
Did she talk about pooping? I was stuck on the swell hell.
No, she said that was the number one issue in the
poop in the Facebook group?
Yes, which you get too because people are afraid to bear down. Oh yeah,
I mean
surgery.
when what we call Valsalva is when you really push with pooping, that is going to absolutely put pressure on your diastasis repair,
which people freak out about. And it's like a lot of women who've had a tummy tuck have had a C-section, so they're kind of used to that feeling of like, issues going to the bathroom for a little while. But there are certainly things you can do to help. One thing I would tell people not to do to address postoperative constipation issues is try a lot of bulking agents. Those can actually be really negative in the long run because they can cause blockages. If you're taking a lot of bulking agents, but you're not having good motility in your intestines, adding like tons of fiber and tons of bulk on top of that, if you're not having good motility, is not really going to be beneficial.
Right.
So getting motility going first.
I mean, that is a side point, but you recommend Smooth Move after surgery.
And Smooth Move is a motility
teeth.
Yep.
Yeah. So I agree with everything you said. And the only thing I would add to it is from an anatomic standpoint, if you think about it, when you do a tummy tuck, you divide your skin and your soft tissue down to the muscle. The lymphatics for that skin and soft tissue run in an axial fashion, means like straight up and down your body. Swelling fluid with lymphatics goes down usually with gravity to the lymph node basin, where are the lymph node basins in that area?
In the groin.
In the groin. You make an incision all the way across. You divide all those lymphatics. And it's not like right after surgery, your body just says, hey,
here's our new path.
This is our new lymphatics. So it's not inconceivable for some people to have delayed swelling purely because they don't have completely functional lymphatics rebuilding at that time. Lymphatics run with your vascular system, with the veins and arteries, and they run almost parallel right next to it. We divide all that stuff during surgery. You're going to have swelling afterwards. Now, why do some people swell more than others? I don't know. Why do some people win the lottery? It's, some people just naturally, they tend to swell more. You tend to have higher, edema associated with their cycles, especially with their, menstrual cycles. Yep. And some people just have leaky veins. The pressure in the veins is easily overcome, and the small holes in the veins, it pushes that swelling fluid out. That's common anatomically speaking, genetically speaking. So, yeah, I think that's a big part of it. And I wouldn't think you would have normal functioning lymphatics for, what do you think?
I mean, I would say a year. I would give it a full year.
Even a year out. So someone who is at 3 months out and has no swelling at all, I think would be the exception to the rule, actually.
And I would think that that's actually not real. They probably just don't notice their swelling. For whatever reason, the way their body kind of processes fluid, or how tall they are, how short they are, like how much soft tissue they have, right. You can kind of absorb it more. Though you brought up a great point with the hormonal component. As women, not that there are not men who get tummy tucks, they can have these issues with swelling as well. But most women know that it's pretty easy for a woman to have a lot of water retention. I mean, I could gain 10 pounds overnight.
And I don't.
Yeah.
And I don't.
And you have never experienced that.
Amy's like, yeah, I'm up 10 pounds. I'm like, I'm up like a half a pound, And that's true. Like women definitely, when they run through their cycles. And that's true even if you're in premenopause, during menopause, and postmenopause too.
Yeah, you still have hormonal fluctuations.
You still have hormonal fluctuations. So it doesn't really matter the age. And that's important. One of the things that Amy and I always talk about is, okay, so Amy, if you do have swelling, the first thing we say is walking is very good, right? So after surgery, just anyone listening to this, if you've had a tummy tuck or a lot of liposuction, you have a lot of swelling, walking is good. And why is walking good? It increases your circulation. Remember, with the lymphatics run with those blood vessels, there's more blood running through it, and this is a simple way to describe it, and it encourages your lymphatics to work too. So that's how walking works. But after that, there are things you can do to decrease swelling. So, Amy, if someone's a couple months out, what would you recommend?
So if they are walking and doing, kind of normal activities again, something I add on that's really easy that most people can do that is pretty much free for most people is just a little bit of rebounding. So bouncing on an exercise ball. If you have a trampoline, doing some really light bouncing on the trampoline, again, that just really gently stimulates lymphatic flow, and it is free. Things that cost more money are going to be things like acupuncture, which I highly recommend, especially for people who are having really persistent inflammation. Acupuncture is really good at helping flush that out. And then, of course, cryotherapy, which everyone knows we love.
This next episode, when we do this again, we got to get the people on to call in, because I would love to ask Michelle if people talked about acupuncture in her Facebook group.
Yeah. Well, we can always reach out to her.
No, I know, but next time we should have Michelle on, or the Michelle person. So yeah, I think acupuncture is really good. What about cryotherapy? How do you feel about that?
Yep, that's why I mentioned cryo.
Yeah,
I think cryo is great for inflammation because it does kind of create that sponge effect. We've talked about that on a lot of podcasts with recovery. Our recovery podcast, we always bring up cryo. It just kind of creates that big blood squeeze.
Right.
Vasoconstriction, vasodilation. As you mentioned, the lymphatic flow is going to go with the blood flow, so it does the same thing to your lymphatics. You get a really big flush. It also helps with endorphin production. That's one of the things that cryo has been studied for is depression and mental health. So it can help kind of give you a mental boost as well. So if you're feeling really down about your swelling.
Your swell hell, if you're really depressed about it, do some cryo. You're going to feel good in the brain and good in the belly. What about IR saunas?
I think that's another great one. As long as you're far enough out from surgery, you wouldn't want to do that with a tummy tuck, and especially with a lot of lipo, you want to make sure that you're at least 2 weeks out before you start that. Your drains are out, your wounds are really well healed. Because even though it's not super sweaty like a traditional dry sauna, you are going to sweat in there. And you want to make sure your incisions are extremely well healed before you're sweating all over them. So if you're cleared for that, yes, great. It's same idea as kind of, it's just a more gentle approach than cryo. It does help, give you that detox. It's getting blood flow. It's getting you sweating. It's kind of just moving those lymphatics.
Yeah, and I think that's a big part of why these people get into swell hell. They're not getting good circulation through there, not good movement. What about lymphatic massage itself, the actual lymphatic massage?
Lymphatic massage can be great. You really need to find somebody who is very skilled at lymphatic massage. It is not like a traditional massage. It is very light. Some people find it to be a little bit creepy because it's
I know you have to be skilled at it, because I told a patient, just go get a massage, and Amy scolded me in front of the patient.
Don't do that.
And I was like, who's the boss here? I don't even know what's going on. But she was absolutely right, because lymphatic massage is a special talent for for a massage therapist.
It is, and it's not meant to work the muscles. It's really meant to work the lymphatics, which are right underneath the skin. So it is extremely light.
Yeah, it doesn't have to be hard. That's the problem. People go get massage, and they're really mashing on these areas that are a problem. You're going to make it worse. What happens when you push on something really hard? It swells more. Okay, so if you don't want the swelling, acupuncture, light lymphatic massage, these kind of things, and then external treatments, LED light treatments, IR, saunas, whatever else. And what about 4 to 5 months out? I know I'm beating a dead horse, but this is kind of interesting to me. What about 4 to 5 months out? Do you change your recommendations at all? Right in the middle of swell hell. It's like, swell hell season. Is there anything different you would do, or would you just try these same things starting with whatever seems reasonable and you can afford?
If a person has tried all of those things and they're still having swelling that I would deem as not normal, like at that point there are some other things you could try, like doing a diuretic, which I would shy away from.
I know, I was totally leading you down that path,
and that's why I know you were, because now everybody's gonna be running to their doctor like, oh my god, I need a diuretic.
I need hydrochlorothiazide.
No, you don't. Like, I need Lasix. Like, I need yeah.
I mean, some people do have that osmotic pressure problem where they just tend to swell, right? I know I have Raynaud's, and when I get Raynaud's, my hands swell. I mean, really bad. So if you have an autonomic issue, there's certain things you might have where I think that a diuretic in that situation with chronic edema might be worthwhile.
Yeah, if what you have is really edema, not just some swelling in the surgical site.
Exactly.
Yeah.
So,
and really following up with your operating surgeon, but then also if it is really persistent, really bothersome to you, following up with your PCP or your internist is where I would go next. Yeah. If someone had tried all the things that we have suggested to them, they've met with their surgeon, and it's really bothersome to you. First, I mean, and not to say that I believe everyone, but take a step back and think about how closely you monitored these things prior to surgery and how closely you're monitoring them now.
Yeah, totally true.
If you were not weighing yourself every day before surgery and measuring your stomach and poking at it and looking at it, and you are now, it's possible that if your doctor's telling you that what you're experiencing is okay, and he's not concerned, he or she is not concerned, definitely kind of think back on that and see if maybe you are tracking things to a point that you were not before.
When you have a lot of laxity of your skin,
it's hard to tell.
Yeah, it's hard to tell when you have true edema, especially if you have girth there, if you have fat and other things. So you're not really knowing if you're swelling with your cycles, your menstrual cycles, or if you're a man that you swell
just in general,
like by the end of the day.
Yeah. Or when you drink.
Exactly. Or when you drink, or if you're salt sensitive, which is that still a thing? Salt sensitivity? I'm sure it is.
I mean, if someone consumes a large amount of salt and they're not used to it, yeah, you're going to swell.
I consume a lot of salt.
Right, but you're used to it. It's normal for you.
Right.
If you took a huge bolus of salt, you would probably swell.
Well, so all those people.
I had 3 pickles for lunch today. I'm going to be super puffy.
All the strength training people we follow, they do salt in the morning. They take a big pinch of salt and eat it before they go to the gym.
Well, it's Himalayan pink salt, though. That's good for muscle contraction. There's a reason for that.
Yeah, I knew that.
There's a reason for that.
I thought it was just like, I don't know.
Like, just, what is that? The girl on the cover, the Morton's.
The Morton's.
The Morton's fish.
I thought he was just taking a shot at Morton's.
Woo! No, it's Himalayan pink salt. It's for a reason. It is. Yeah.
I feel like Himalayan pink salt is like the answer for every ailment.
It might be. We didn't talk about sitting in a salt cave for swelling.
Oh, yeah.
Which is something you could do. So that's something I've tried or can attest to.
So swell hell is real. Michelle, great question. And to your Facebook group, thank you so much for debating swell hell and working through the quote-unquote treatments for this issue. We talked about a lot of different things that would help. Amy and I just really want to say it's very specific to the person. And that's why we take pride in what we do postoperatively. Not every office does that. It doesn't make them a bad office or bad surgeons, but we do really focus on the recovery in our office, okay? So you need to reach out to your surgeon. If you come up short there, then that's where you go to your internist and maybe try some of these things that Amy and I talked about. And if you've tried everything and you're still in swell hell, just call Amy. She'll figure it out pretty much. That's what I do. If we can't figure it out, you just call Amy on her voicemail.
Yes, on my voicemail. All right.
That she tells you every episode.
So thank you so much, Michelle. We're going to take a quick break to get a word from our fabulous sponsor. Let's get checked, and then we'll be back.
Let's get checked.
Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked is really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like, you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly. And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like, is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30,
yep,
so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where 2 of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC, so TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
Yeah. All right, we're back. Just as a side note, I mean, I want you to use our code for Let's Get Checked, but Let's Get Checked did just send me an email that they're doing 40%.
Fire sale.
Yeah, they're doing 40% off. So, if you
don't use our code.
If you've been wanting to try Let's Get Checked, use the code for the sale right now because it's better.
What if they try to combine it? Get 60%?
They can't. Okay. No, you can't. That would be sweet. And ours is for first-time users only. So if you've used our code and you want to get additional tests, you can use the 40% off code. So, yeah.
I was trying to figure out what I wanted to test.
Just like vitamin D serum levels?
Sure.
Like, I don't know. CBC?
Sure.
Yeah. Yeah. All right. So we're back into voicemails. We're back with our second voicemail. This is a great question and something that we talked to a lot of patients about. What happens when you get conflicting advice? Like you get a bunch of different consultations. I was going to say consults. You get a bunch of different consultations, and everybody gives you kind of different advice or, has a different process.
And the answer to that is not just ask Amy and Dr. Martin, right? That's not the right answer?
No.
Okay.
Well, let's listen to the whole question
All
first.
right.
So here we go.
Hi, Amy. First of all, I absolutely love the podcast. I think it's super interesting, and I've listened to almost every single episode at this point, despite not being in the market necessarily for all of the procedures that you guys talk about. But so my question is, so I am I'm a massive weight loss individual. I lost over 120 pounds through diet and exercise over the course of 2019. And now I'm in the market for a breast lift and augmentation, as well as a procedure to deal with all the excess skin on my stomach and legs and backside. So I have interviewed 3 different surgeons. And my question is how to determine the best procedures for you in the face of conflicting advice from multiple plastic surgery consultations. To give you some context, Surgeon A insisted that I wouldn't be happy with anything less than a full belt lipectomy, doesn't use progressive tension sutures, said I would go home with 6 drains after staying 1 overnight, and he would do the procedure at the same time as the lift and augmentation over the course of 6 to 8 hours. Surgeon B suggested a belt lipectomy, but said that he wouldn't, quote, wouldn't cry if I decided to only do an abdominoplasty. He does do progressive tension sutures. He said I would go home with 2 drains, not 6. And I would go home that day and return 2 days later to do the lift and breast augmentation. And yet Surgeon C insisted that I absolutely only needed an abdominoplasty. Sort of full belt lipectomy would be a waste. Does progressive tension sutures with no drains. I would go home that day, and then he would want me to return in 3 months for the lift and augmentation on my breasts. So I feel like I have conflicting sort of opinions on not only which procedures to do, but sort of what's safe to do in one surgery or on different timing. It's a little bit confusing, it's a little overwhelming, and I'm not sure what to make of it.
That was a great question. And it's interesting how very different the advice from 3 different surgeons was.
Yeah. I should just like pose as her cousin and just go to these consults with her again, because I would love just to figure out what the hell's going on there. Why can't you do a surgery over 4 hours? Exactly.
Where's the data on that?
We have to say thank you for listening to all of our episodes. We love this. And I can't tell you how many people have said that to us, support us, and love this. And they just love the idea that we give good information and it's entertaining. So thank you. Secondly, but most importantly, the fact that you lost 120 pounds has Amy and I so pumped up right now. Like, I don't even care about the questions. I just want to focus on the fact that she lost 120 pounds. Did she say that she had surgery or not?
No, she said through diet and exercise.
Oh, God, that is amazing. Yeah. And she is a true aberration. Amy and I have talked about the odds of maintaining a greater than 30-pound weight loss over 3 years. For women, it's like 1 in 180 or something. And for men, it's like 1 in 230. It is so rare. So you are a unicorn, and we think that's awesome. Now, in terms of advice, so Amy, let's go through this because we hear this all the time. And I love my fellow surgeons, and I want to believe that the patients are not hearing them correctly, but I actually believe the patients most of the time because they're very specific and they write stuff down her. Yeah. I think that that's what they actually said, and that's complete BS. So let's go through first her and then talk about what a patient does, or do you want to do that vice versa?
Let's just you answer this one first, and I'll answer it second.
Okay, good. Yeah, so for her, no question, if you lose 120 pounds, a tummy tuck would be suitable, but a belt lipectomy is probably what you need. Now, obviously—
Especially if you're over like 35.
Exactly. Yeah. Now, let's just say this is where it gets into the wordsmithing of plastic surgery. And this is where I hate plastic surgeons. I do this. So they start putting words to things, and you have to, because if you're going to charge someone for an extended tummy tuck, you got to call it something, a belt lipectomy or whatever. Okay. So clearly you're not just going to need a normal tummy tuck. I'm not looking at you. I'm just making a guess here, but 120 pound weight loss.
She did mention her buttocks too. And if that's the case,
right. Yeah. So that's either an extended tummy tuck or a belt lipectomy. These are all just words. You got to get rid of all the loose skin. Mm-hmm. Does the loose skin go not just in front of your belly, but around to your sides and your back? Or you have a loose skin in your butt, most likely, right? Okay. So we know that you have to treat your trunk circumferentially. We've talked about this many times before on this podcast. That's the number one mistake. Why would you not treat someone circumferentially, especially someone who's lost 120 pounds? But here's the secret. You don't have to do everything at once, okay? You can figure out what we talked about on the body contouring thing about weight loss surgery, after weight loss surgery, is that, or after massive weight loss, which is, what do we say, over 60 pounds, is that you can mix and match what you think is appropriate and try to fit it within that window of time, preferably less than 8 hours where you can maintain, safety. You know what I'm saying? Secondly, people that come back 2 days later to do a mastopexy aug, that is like straight up early 2000s, maybe late.
Yeah. Like find a woman who had a tummy tuck and 2 days later wants to have more surgery.
Right.
She does not exist.
Now I get why they're doing that, and they're doing it not maliciously, and they're doing it for safety purposes, but that doesn't make a lot of sense to me. Now that's my professional opinion. Okay. Some people may think differently. You would do those together, and that's where
Can I interject something funny in this? So we did back in the day, we would occasionally offer someone who wanted really to avoid OR and anesthesia costs the ability to split up their body liposuction into 2 chunks one day after the other. And we did it a couple of times. And then we had a patient come in for the second day with her husband, and they sat there and they're like, there is no possible way that she can go through that again on the next day. And did she come back 3 months later and do the rest of her lipo? Yes.
She did.
But it is.
That's we call that stacking, and that was really pushing.
It is very hard, and we stopped doing that just because it was like, to what end? Like, why are we doing this?
Right.
Like, is it making their recovery better? No, it's not really helping anyone.
So for you, what I would do is rank what's most important to least important. Is your breasts or your belly or your butt or your arms or your thighs, and then you go from there. And you have that ranking, and then you go into the surgeon and say, this is my ranking of the areas that are important to me. And now we need to figure out 8 hours or whatever we decide is safest for me and my physiology. It could be 4 hours if you have things going on with you. It could be
in the facility too.
Yeah. And there's limitations there. Whatever you and your surgeon decide that's safe, we're not going to tell you what that is. And that's patient specific. And then you fit that in. We've done tummy tucks where we extend it secondarily and do the backside. Okay. Which is basically a belt lipectomy or even a body lift. We've done the tummy tuck first and the back part second. We've done tummy tucks, mastopexy augs. I seem like I do that every week.
Yeah, we do that a lot.
Okay. And then we'll do the arms later on, do the lipo here and that kind of thing. That's where I think everyone loses the forest for the trees. When the doctors see a patient like you, it just drives me crazy. They should think of you as a project. And how can we get to this end goal, whatever your goal is? And maybe that's just to make your breast better and live with the extra skin everywhere else. How can we do that in the smartest fashion, the most efficient, that doesn't, go excessive on the investment, which is going to be a big investment, and allows you, most importantly, safety and recovery? How do we do that? And that's how Amy and I approach these. And so for you as a patient, unfortunately, you have to empower yourself and think about that before you go in and then have that conversation with them. Because in plastic surgery, there is no right way to do things, okay? We're all a bunch of arrogant artist type people that are going to tell you that their way is the best. And guess what? I can do a tummy tuck. I can do a belt lipectomy. I can do a tummy tuck that's extended. I can do a mini tummy tuck and float the belly button. I can do anything I want. I literally can do any type of surgery I want.
But if you don't call it something special.
Exactly. So I don't want to belabor that point, but just so you know, definitely you need to pick what is most important to you, and then you need to fit that within a safe range, and that's usually less than 8 hours. Okay. And if you're doing that much surgery, FYI, we admit our patients. We give them IV fluids overnight, very important.
IV pain meds.
And IV pain medications. And also the next day, almost always I will send those patients home on Lovenox, which is low molecular weight heparin, because deep vein thrombosis and unfortunately pulmonary embolus would be very common when you get these long cases, especially in different types of positions, especially if you tighten the abdominal wall. So it's very, very important that you go to a facility that can monitor you overnight. That's my professional opinion.
Yeah.
Now, what do we tell everyone when they get differing viewpoints? How do they approach that? Because they're not plastic surgeons, and this is not a perfect science. Most cases are puzzles, and the way you put a puzzle together can differ from person to person. Some people do the outside. Do you do the outside first?
I do the outside first. I'm a border.
I don't. I'm a color person. I put the colors together. What do you do, Nils? Do you
border
do borders?
wall.
Okay.
Yeah. Got to get the
Why
borders.
don't I do it the hard way?
Get the frame built.
I look at the picture and then I try to find the colors and I group all the colors together.
Oh, see. It's a good combination, though. I used to do puzzles with someone who would do that. So it was really easy for me to come in and just like do stuff because they would spend all this time sorting pieces. And I would just be like, ooh, I'm going to build Yoda. And like, oh, here we go. There's all the green. Perfect.
Yeah.
Like, I'm going to build this tree over here.
There has to be some psychological profile in puzzle solving. So let's just go through what people do when they get differing opinions.
Do you want me to give my
please.
opinion?
Yeah.
So first off, again, thank you for listening to our podcast. If you have not gone way back in the Wayback Machine and listened to our podcast where we talked to a patient about her weight loss story, but also about her surgery story, I would highly recommend it. There is no video for it, so it's not going to be on YouTube, but it can be found on all the podcast apps. I don't know what number it is, but it's Nils is going to look. He'll find it.
Number early.
Yeah, early. And it's really great because we actually talked to a patient who had lost weight. She actually lost weight twice. So she ended up losing a large amount of weight, got pregnant, went through divorce, gained a lot of weight, lost it again, all on her own both times. It's probably the best podcast we've ever done. I mean, it's amazing. So she came to us, again, had all of these issues, right? Arms, her breasts had been destroyed not only through breastfeeding multiple babies, but through the weight loss. Legs were tough. Stomach was bad. I mean, it was kind of everything. And
Single mom.
I mean,
So didn't have tons of money.
Her story, though, it is absolutely amazing. But she had saved. Like, she was ready. And same thing. We kind of laid it all out for her, all the things that could be done. And Dr. Martin gave his opinion about what she should do first, and that was to address her abdomen and her breasts. She decided, and that's why before I made her quote, I said, what's the most important thing to you? Because of all these things we talked about, we can do 2 of them. So you can pick your abdomen and your breasts, your thighs and your breasts, your arms and your breasts, whatever, but it's going to be 2 things, essentially, just because her excess skin was pretty severe and any of these things were going to be a pretty long surgery combined. So she chose to do her legs and her breasts first. And then secondarily, we did her arms and her abdomen. And that's what worked really well for her. So I think that's really what, like Dr. Martin said, you got to pick what's most important to you first. The second part of that is, I'm assuming that all these doctors you've seen are board certified plastic surgeons in whatever country you live in. That's the first thing. And then I would really go with what doctor gives you the best feeling? Who do you feel like you really mesh with? Their approach. You know, to me, people do get lost in these like 2 drains versus 4 drains versus whatever.
Quilting sutures. What did she?
Yeah, progressive tension sutures.
Progressive tension sutures. I mean, all that stuff is background noise, you know, because in reality, these things are not going to define the surgery. Your outcome is not going to be terrible if you don't use progressive tension sutures.
Or if you have an extra
I know
drain.
you don't want to hear that, or if you have an extra drain, if you don't have drains, you know, none of these things are going to contribute to the overall like kind of outcome.
Right.
So they may give you more discomfort or less discomfort. They may be, you know, whatever the case is, but your outcome is going to be your outcome if you go to someone who's reputable, board certified, and does a good job.
Exactly. And we had a patient one time who was really hung up on, she'd had a lot of consults and one of them had told her something about this, you know, special technique to suture up her thigh lift to the fascia. And I'm like, yeah, he does that. She's like, are you sure? I'm like, I've literally watched it happen. Yeah. So I'm like, I don't know why that doctor called it this and why I didn't know what that meant, because that was a term that only he used.
My special technique when they say that is basically code word for I'm just trying to sell some stuff here. Okay. Right. And we all do some similar things. So why do you think outcomes are better in some hands than not? Do you think it's because of technical ability? It's actually technical ability is part of it, but the big part of it is this noggin thing in your brain, okay? The way you plan. My approach to puzzle solving is better than Amy's. We've established that. You go with colors first. No, but seriously, it's your approach to surgery. That's how I teach the fellows. Like, as I said before, someone like me can do any type of approach. I can do progressive tension. I can do quilting sutures. I can do drainless. I can do it with drains, without drains. It's not hard.
We've even used the internal glue.
Yeah, it is not hard. Newsflash, there is no unicorn special procedure out there. It is the way you approach the surgery. It's a surgical plan. And most importantly, like Amy's saying, are they listening to you?
Yeah. And do you feel like their aesthetic meshes with yours?
Right. Do they even care? Are they hearing what you're saying? Are they sitting down with you as a human being? And I know this sounds emo. I feel like Oprah right now. Okay. But like,
you don't look like Oprah.
Really?
No.
I would love to be Oprah for a day. I'm just not even joking. So if if they sit down with you and they're really listening to their staff, maybe it doesn't even have to be sometimes the doctors have Asperger's, their staff is the staff actually talking to you and listening to you and understanding you. And that's what's most important.
A doctor telling you he's going to cry, he or she is going to cry if you don't do a specific procedure. Well, that's on them. Like, don't let their emotions affect your surgery.
Which is weird.
That's a weird thing to say to someone.
Why would you ever say that?
Yeah.
Why would you like emotionally shame somebody?
I mean, you have said to people before, like, please let me do this.
No.
You know.
Okay. Yeah. So I'm not perfect. I have blood in my hands too,
Yeah.
like literally. So,
It's human nature to want to make somebody
right.
better.
And I'll tell them straight up. I was like, look, just pick what's important to you. I have to admit that I want to see this through. I want to complete this project. That's why I went to plastic surgery school, because I'm a person that likes projects to complete. Yeah, if you have problems all over your body and you just want to do your breast, I totally get it. And I support you on that. In the end, you're the one paying money, okay? You're not there to make these surgeons happy. Like, you need to go demand what you want and see if you can do that safely, get their professional opinion, really listen to what they're saying, their recommendations, collate that in your head and pick the best fit for you. But I do think having an office that understands you, number one, is important. Secondly, having a discussion with you, your family members, whoever, about money, because these are very expensive surgeries, how you want to break that out. If you have all the money, great. If you don't, how are you going to break it up? How are you going to break that up financially so it works for you? And third, recovery. People actually work. If you do your arms, your legs, your abdomen, and your breasts in a 12-hour surgery, okay, you may not be walking for 4 weeks.
Maybe walking, but you need some help.
I know.
You need some helpers.
So I think it's important to also feel like you fit in at the office. Now, you don't have, when we say fit in, we don't mean like you want to be friends with these people. What do we mean fit in?
I would mean that like your aesthetic matches theirs, so that
Right.
you feel like they understand what you want. Let's say if you're a woman going in for a breast augmentation and all the pictures they show you, you don't identify with, they're all women whose breasts are way larger or way smaller than you want to go. You kind of got to think, like, does this practice really fit me?
Right.
And have we done implants that are extremely large? Like, yes, I have ordered the largest size in the book. I've also ordered some of the smallest implants ever. We do a lot of different ones, but for the most part, our patients are very natural looking. They want a natural aesthetic.
We got
They're
like
moms.
a Goldilocks breast
Yeah.
practice.
Like we are
They
not.
want it in the middle.
Yeah, we're not showing. All of our pictures are not of women who have 600 plus
No.
cc implants.
And we get patients like that to come in, and I love those patients, and I'm laughing with them. I'm like, I can't really show you what you want because we don't do that here.
Not that we
Your
couldn't,
800
but-
cc implants, that's not big enough. I need bigger. Okay, you're in the wrong place, and that's okay.
Yeah.
There's nothing wrong with that. We support you. Go get your big breast implants.
Yes.
There's nothing wrong with that.
Absolutely.
So I think that that's an important thing. I do also think that the responsibility on the office, the doctor specifically, is to explain and educate and empower. So if you're going into an office and you're leaving, you're like, I'm not really sure why he's saying this 2-day thing. Like, this sounds a little bit kind of questionable. 2 days, then do the breast thing. Did he give you a full explanation of why he does that? Did he educate you and did he empower you to say, this is why I'm telling you to do this for safety purposes, or et cetera, et cetera?
Well, and what that's going to do for you as a person too. Like it is very challenging to have back-to-back surgeries.
Yeah.
Even for people who are very tough, and even for, like I said, we were doing it for liposuction cases. So not even incisional surgery, we were doing it for lipo. And it's still hard. Like, it takes a lot out of a person to do that, which is not to say that surgeries can't be staged. Like, we do that a lot. There were doctors, oh my gosh, for the longest time, like years ago, doctors wouldn't do implant removal and exchange at the same time.
No, they wouldn't do breast augmentation with a lift.
Yeah, they'd make you wait.
They do the breast augmentation and make them wait like a month or two and then come back and do a lift.
Bizarre.
And that's great and all. I mean, that I'm sure that has a safety benefit, but you're not going to have a practice. I mean, that people want their surgery at the same time. Yeah. And you should be technically, gifted enough to be able to do that at one time and be able to manage the risks associated with the surgery. Mm-hmm. Massive weight loss patients are not easy patients. They have higher risk for complications. We've talked about this in that episode. Even with the weight loss, you still have some of the residual risk factors you had when you were obese. And you should go back and listen to that episode. I forget which one it was.
It's episode number 19, and it's called Weight Loss.
Number 19,
but there was
weight loss.
another one we talked about recently, and I don't know what it was, but 19 is the one you should listen to. That's with the patient.
We also let's talk about fat. Is that
Maybe. There was something where we talked about it. It was recently in the past year where we, and Amy and I were, and maybe it was one of our science research ones, where we were talking about that when you lose the weight, those patients still have higher risk for DVTs, deep vein thrombosis, blood pressure issues, bleeding, infection, like all the risks you have when you're obese. So that my point to this is, you really need to focus, and the surgeon really needs to focus on your safety, really scope in that safety profile, that risk profile, and figure out what's best for you. Every patient like her, I always look at first safety. Mm-hmm. That's what I first say to myself.
Big surgeries.
Yeah. And then I go from there and then rank what's most important to them, what's least important to them. And then I think about what I see this project as. So.
Yeah. Yeah. So hopefully that answer is helpful. If you have any questions, you can always leave us another voicemail.
Right. And again, if you're getting differing advice from different plastic surgeons, call Amy on the voicemail, leave a voicemail.
All right. So we got one more. You ready for our third one?
Yeah, I'm ready.
Okay. So this is a really interesting question. And we'll of course play it, but she's basically talking about, she feels like she has a breast lump that is putting pressure in some areas. Can it be removed with a breast lift? It's a little more complicated than that, but we'll play it now.
Hi, my name is Jessica, and I just discovered your website and your podcast yesterday. And my question, so you might have covered this already, but I've only seen a couple of the podcasts so far. So if you've already answered it, let me know, and I will go check out the podcast. But I have, in one of my breasts, I have like a growth. It's benign, but it seems to be like, to me, and I haven't had it checked out since we first discovered it, which was probably about 3 years ago. But it seems to me like it's getting bigger. So one of my breasts is, and I've lost a lot of weight, so one of my breasts is kind of small and saggy. The other one looks fine, I guess, but it's got the mass in it, which makes it a lot heavier and fuller, and it's just kind of icky. Like it just feels weird. And sometimes when I'm wearing a sports bra, I can really feel, the pressure up against it. If I were to come in for a breast lift, is this something that can be addressed as well to take out whatever growth or cyst or whatever that is? Can that be taken out and then the breast lift done to make the breast look the same? So that's my question. I hope I asked it correctly. All right. I'll be looking forward to the podcast where you answer that. Thanks so much.
Well, thank you, Jessica. That was an excellent question that we have never addressed on our podcast.
No.
Ever.
This is the first time.
Yeah.
And I've actually done this surgery.
Yep, I was just going to say, we have done this
multiple
a couple of times.
So I thought that was an awesome question. And thank you for listening, and definitely listen to some more podcasts and call back and leave some more voicemails. Thank you, Jessica. So 100% you can remove a breast lesion, benign or cancerous. And obviously this is benign. So you've had it worked up, but just so you know, is it benign because you had a biopsy and they said it was benign? Are you being followed by your internist or a breast surgeon for this benign mass? And you didn't say your age. Are you getting mammograms? Do you have a family history of breast cancer? All these things. This is very important. So make sure you're doing what you need to do. But if you have a mass there, no matter if it's cancerous or not, and this is obviously benign, you could definitely take it out through a mastopexy or a breast lift. I do that a lot. What we're doing now is oncoplastic breast surgery, meaning that we're doing a lifting and reduction procedure and also doing a lumpectomy for breast cancer at the same time. And we would do that bilaterally in both breasts and for symmetrical purposes and do that. But for sure you can do this. Now, if the mass is in the inside of your breast or on the outside of your breast, we can change the way we do the breast lift and maintain the nipple and areola and all the things we need to do depending on where that mass is and design the surgery. If the mass is right underneath your nipple and areola, that's a different story, okay? There it might be a little more difficult. Having asymmetry with weight loss is not uncommon. Having asymmetry because you have a mass on one side and not on the other is, we've seen that before. And a lift can solve that problem. So a lot of times with weight loss, you'll need an implant too. And you could do that at the same time too. If you needed an implant, a lift, and the mass removal could all be done. Yeah. Interesting.
It is really interesting. And, this is actually a good example of when we have done a 2-stage surgery. The patient was very young. I mean, she was in her early 20s who had this
phyllodes.
mass. Yeah.
Phyllodes tumor, I think that's what it was.
Yeah, it was a really unusual tumor. And I'm sorry if you guys are hearing that. The wind is blowing really hard and there's a metal scraping sound on our roof. So
Yeah.
we used to joke that it was Jack Sparrow
Yeah.
because it sounds like there's a pirate up there dragging chains along the roof. So
I mean, would you laugh if there really was a pirate up there?
I mean, that'd be awesome, actually. I didn't know there were pirates on a landlocked
Hey,
state.
dude, we got that you're pirating.
You are far
we're
from the
we're
ocean.
podcasting.
Yeah. So if you hear some metal scraping, it's just Jack Frost or
Yeah.
Jack Sparrow. It's fine. Yeah. So we took the mask out, and at the time, like she just wanted the mask on. Several years later, came back and decided she did want to have an implant. We'd offered her the implant at the time of surgery. She didn't want it then. Came back later, and we did put the implant in. Now I know there was something more complicated with her medical history that you know more about when she was seen with you secondarily. But
Yeah, she had some medical issues. Yeah.
Additionally,
But she had notable asymmetry.
Yes.
And when we took the mass out, it wasn't like she was symmetrical. Actually, she was smaller on one side than the other. And that's, ultimately we had to put an implant in for symmetry purposes.
Yeah. And her implant was on kind of like the lower outside part of her breast.
Mm-hmm.
So when we took it out, it was in a bra, it wasn't so noticeable because she could pat it really well.
You mean her mass, the mass.
The mass, yeah. So her breasts still looked fine, like in a shirt from the front, but like it was definitely, she had something she had to fill in her bra. So
Mm-hmm.
it was interesting, but there's a lot of options. That's a great question. I'm surprised we have never talked about that.
So if you go into the plastic surgeon's office, they're going to want absolute verification that this is not a problematic lesion.
And they'll still test it.
And they're still going to send that off to if they don't, then I totally disagree with that. Again, this is not a medical podcast. This is only our experience. But they need to send that tissue off to the pathologist when they take it out. Okay, even though you had a benign biopsy before. So remember that you're going to have an extra cost with the pathology fee and the pathologist's review of that specimen. But they could definitely do that. And then when you do the mastopexy or the breast lift, you can reduce the other side if you need to make it
Well,
symmetrical.
she said the other side is smaller.
Well, when you take this mass out, the left side or whatever affected side may be smaller. So you can do symmetry parts of this procedure to make everything the same.
Yeah. So there are a lot of good options.
Yeah.
And thank you so much for listening, Jessica. I'm glad you found us.
We love Jessica.
Yeah. All right.
So if we had 1,000 subscribers to our YouTube channel, we could send Jessica, some swag.
She could buy merch in our merch store.
No, we would just send it to her.
Well, that's different.
Well, that was good. That was good. If you're watching the YouTube channel, there's a picture of me next to the number,
Yes.
looking at you menacingly.
Yeah.
You should call us. It's important.
Yeah. So for those of you who did listen to this podcast, if you're new to the podcast, you've not heard me begging for voicemails in the past. Now you know that I do listen to them. And we will play them on the podcast. So if you would like to leave us a voicemail, please give us a call at 303-630-9038. And you can also send me messages on Instagram and YouTube. We check all of those as well. We're on YouTube at Jason Martin MD and on Instagram at Beauty and the Surgeon Podcast. I think that was a really good one.
Oh, I loved it. I loved all three of those questions. They were amazing.
They were really good
Yeah,
questions.
this is in my top 10, this
Yep.
episode.
Now, we've got some guys to call in too now. Just
I don't know.
all you ladies
I like the
listening, make your
ladies.
husband
I like the
or
ladies from the
boyfriend
Facebook groups. I want to hear some more poop questions and swell hell.
all right.
Yeah. We're getting all the lingo.
Yep, we are.
The
We're getting
patient lingo.
Yes. All right. Thanks so much, everyone. We'll talk to you soon.
See ya.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.